There's no such thing as TMI, okay? When I became a pelvic floor PT, I looked myself in the mirror and said, penis, penis, vagina, vagina, vulva, vulva. And now I'm 100%.
No, you did not.
You have to.
What's up, guys? Today we are going to talk about something that our patients say to us very often, and it is too much information.
Yeah, patients will come in and be like, okay, I know this is too much information, or they'll say, sorry, I know this is too much information. And I'm like, no, listen, there's no such thing as too much information in this clinic right here.
And I think what'll help us talk about this is probably explaining what the heck pelvic floor PT is and why there is no limit to what you can tell us in this space. So you want to
Unless
take,
you
like
murdered someone.
Yeah, don't tell us that. We'll have to tell the cops.
Yeah, don't tell us anything that it could. Yes. Anyways.
I mean, you can tell us if you want, but we'll tell the cops.
Yeah, well, probably. That's probably like.
We'll have to report you.
I was trying to think of one thing.
I was like, maybe do tell, but don't tell me because then I don't know.
But you can tell me what your poop has looked like in the past week.
And actually, I want to know that.
And I want to know. And I will ask you. All
right, Hannah, what the heck is pelvic floor PT? What do we do?
Oh my God, we do so much. We are pelvic floor physical therapists. We are sexperts. Sexperts, not sex birds.
Not to be confused with sex birds.
Which is what Instagram thought we were saying. But we're physical therapists that specialize in treating pelvic floor dysfunction. Pelvic floor dysfunction can be a total, like a realm of things. Pelvic pain, urinary incontinence, constipation, any issues with like bowels.
Yeah, I would just say we are physical therapists who specialize in treating issues surrounding the pelvic floor. Your pelvic floor is a group of muscles that sit in the pelvis. They serve the body in a few different ways. They maintain continence. So that's where when Hannah's talking about bowel and bladder, they're making sure we can contain our bowel movements and our bladder movements to when we want them to be released, and vice versa. We're not able to go. You know, we work with a lot of constipation and difficulty voiding. The pelvic floor aids in sexual function. So just for one example, an orgasm is one large contraction of your pelvic floor muscles. So that's, we treat sexual dysfunction quite often.
It's the best muscle contraction in the body.
Yeah, trademark that.
The most slay muscle contraction.
The most slay. Stability and support. So your pelvic floor is supporting all of the muscles above it and around it, all those vital organs in the abdomen.
Support your baby when it's growing.
So with all of those vital roles that the pelvic floor plays, we obviously can have dysfunction in that area. And I guess the reason we're seeing it as physical therapists is because it is a muscular issue a lot of the time, because there's so many muscles that make up your pelvic floor that can be affected. Basically, I like to think about it as if you're training for any large event. So pregnancy is an easy example of this. When we see pregnant patients, it's like we don't really prepare the bodies optimally for childbirth and postpartum recovery. And in a lot of cases, we're seeing patients postpartum with dysfunction because they had simply no idea that they could benefit from pelvic floor PT during pregnancy. But if you think about childbirth as a marathon, are you just going to like go into marathon day like la-di-da and then be like, well, if I like sprain my ankle doing this, I'll just take care of that after? That's how we're treating a lot of postpartum women.
Yeah.
It's like they're coming to us and they're like, okay, I had a grade 3 perineal tear, but it's really something that we could have worked on in advance to not only prevent the likelihood of, but just recover from a lot easier.
A lot of the women that we treat during their pregnancy and then they come back to see us postpartum, like sometimes I've literally had like a patient come in and be like, yeah, like I'm doing good. Like,
yep,
I have no pain. I'm not leaking. I'm whatever.
Yeah.
But we will still do like check-ins postpartum and like still get them to like a function, like whatever their functional goals are, going back to like, I don't know. I'm saying this because someone said it recently. I want to go back to Orange Theory classes like 3 times a week. that's going to be something we can definitely work on with you, because it's not going to be fun to do that like 6 weeks postpartum when your doctor's like, go back to exercise, and you're like, okay.
Yeah, that 6-week postpartum visit is utter bullshit, for lack of a better term.
It should be required. Come to pelvic floor PT at 6 weeks. Let us help you. If you want to go back to like kickboxing
Not
or
the
something,
kickboxing kick
or whatever, like let us like get you there.
Yeah. Just a side note on that. If you're postpartum and you're medically cleared at that 6-week mark, and you're really discouraged because your physician looks you in the eye and says, okay, you're good to get back to having sex, running. I know you just made a post about this too. Go for it. You're cleared. You're good. And you're just like, what the heck? I'm in pain. I haven't worked out in 3 months. I don't want to touch my partner. That's the last thing.
And I'm terrified of anything entering my vagina right now, because I just produced a live human being out of my vagina. And now like you just are like, okay, now you can put a penis in there.
Yeah, absolutely.
Excuse me?
Wild.
No thanks.
That visit is strictly based on tissue healing and medical clearance. So don't be discouraged by that. But do see a pelvic floor therapist, because we're the ones that aid in the actual recovery of those tissues. That's what we're specialized in. We're not looking at it from that. Like, we want you to be cleared medically. Of course, we want to make sure those stitches are healing. If you had a tear, we want to not go in there if it's not ready to be gone into. But from there, that's where we can take it away and really get you back to doing those things.
Yeah.
And readily and happily, because just like getting up and working out and having sex again 6 weeks postpartum is not realistic for most people.
I actually, when I was in school, I made a post on my Instagram, and I said, I was doing like a research project or something for my clinical. So I did a post on pretty much on the knowledge of pelvic floor PT. And so I did a post and it said, what is pelvic floor PT ? And then it was just like a blank answer box. And then people like wrote in, they were just like, they treat incontinence, they treat incontinence, they treat incontinence. They help you after you're pregnant. But there's so much more than just incontinence and pregnancy and postpartum.
Yeah.
We treat, just like we were talking about, pain with the intercourse too, is a big one. Vaginismus, endometriosis. There are so many other diagnoses that we can treat.
Okay.
What's another thing that you treat for fur?
Boots with the fur.
What's another thing you treat?
What's another thing I treat?
What else do you treat? Tell me.
Something else that we treat prolapse. Pelvic organ prolapse can present in a few different ways. It can be caused by multiple things. We see this postpartum probably most often, but it can be a chronic issue as well. So prolapse is when the structure of the pelvic floor is not holding up. So we'll use people with vaginas as an example for this. So with prolapse in this case, if you have a rectal prolapse, it would be bulging into the vaginal wall. And same with the bladder or uterus if you have a bladder or uterine prolapse. And often we can grade these things ourselves, but people also come with diagnoses already. And they're like, what the heck? I was told I have prolapse. What do I do now? I'm scared to lift weights. I hear that all the time. That is not an exaggeration. Like, I'm scared to work out. I'm going to make it worse. No one told me anything about this. I don't know anything about prolapse. So that's a huge thing that we're just educating people on often. And they say physical therapy who's they? I don't know who they are.
The gods of the PT world.
Research shows that PT can reduce the symptoms of a grade of a prolapse by about 1 degree. So
yes!
Up to 4 degrees.
I don't know where I read that, but I also have been saying that lately. Did you tell me?
Well, it's a fact.
Because for a minute I was saying like we can't reverse a prolapse, but then I read some like research article and it was like you can reverse a prolapse by 1 degree with PT.
Yeah, I learned that in my continuing ed.
Really?
And I looked into it a bit more, and it's true and cool.
Yeah.
So that's what I'll tell people. Like, if you come in with a grade 3 and you're experiencing heaviness, pressure, not able to run because of these symptoms, we can reduce those and see where we're at then to about a grade 2, which can be asymptomatic, which is cool. So that's something we really like to treat. And I think we're raising a lot more awareness on as a profession. Prolapse can be managed. with surgery and with like pessaries, things that you insert to help support those organs too. So there's a lot of different avenues you can take with a prolapse. And then some other things we'll treat in pelvic floor that are less assuming would be like people post-operatively for like hip and knee stuff even at times. So we'll see a lot of like post labral repair surgeries, maybe like a year later, where they're now experiencing pelvic pain. And it's because those deep hip rotators are involved in pelvic floor function. And that's something maybe we should dive into, just like what are the pelvic floor muscles and what do they actually do? Because that'll help educate too. But we'll see a lot of people with hip issues that end up being pelvic floor issues.
Another thing we treat, ask me.
Anna, what do you treat?
We treat pelvic floor for people with penises as well.
Big time.
Erectile dysfunction is something that we can help with, like rectal pain in general, pain in the penis even, testicular pain. There's so many things that like that is something that like we don't get enough referrals for, or I feel like patients with those kind of symptoms, they usually are like, we're like their last resort. I feel like they don't often come to us until it's like, okay, like I really need to do something about that. So I hope that starts.
Yes.
I hope we can bring more awareness to the fact that we treat that as well.
I do feel like in the last year we've seen more and more already, which is great. But yeah, come to us with your penis problems because it's definitely something we want to see more of. We want to get the advocacy out there and help people know that it's an option and it's something that can really help. I mean, I see a ton of success with those patients.
Yeah. No, seriously. And quickly too sometimes.
Yeah, because it's usually a matter of tension.
Yeah. Tension.
Muscle tension, something we treat.
Yeah, guys.
PTs. What's your favorite thing to treat?
My favorite thing, I mean, I love like treating everyone and making everyone feel like confident, but I do really like helping. I love I'm a PT. I love treating pain. Yeah. I love treating specifically pain with intercourse, like pain, like dyspareunia, mostly because people are so unaware that is something that we can actually treat and like make better. It's like people will come and be like, yeah, sex has like never been great. I've never had an orgasm. I'm usually just trying to like push through it. And then we teach them all these tools and they're like, oh my God, now like I had a patient actually yesterday come in and was like, big news. I had first time amazing sex since my delivery.
Amazing.
And it was pain-free and it was great. And I was like, like hell yeah. It was such a good start to that visit. But
that's great.
What's your favorite?
I would probably say the same thing.
Yeah.
I think it's really, I hate to use the word rewarding because that's not necessarily why I went into healthcare. It's like we want to help people regardless, you know, the outcome and how it feels for us. Basically, like what you said, when people come in and they have no idea that something isn't supposed to be this way, and then you can change their mindset and actually help them enjoy something that they've wanted to enjoy their whole life. That's just a really great feeling. And it's why we wanted to be PTs, right? Like you said, we want to treat pain and those kind of symptoms. So I love treating painful sex.
Is an ADL.
It sure
sex is an ADL. Sex is an activity.
What's an ADL, Hannah?
Sex is an activity of daily living, okay? I don't care what insurance says. Sex is an ADL.
That's why insurance is garbage. You'll hear us talk about that too. Yeah, absolutely is an ADL.
I also love treating incontinence too because that is such a frustrating issue. Yeah, and sometimes we can fix it so quickly with just like bringing awareness to the pelvic floor. Yeah, like in a couple visits. Sometimes it takes a little bit longer, but it's something that we can fix so quickly, just like any like bladder issues.
With a lot of incontinence, it's people who are pretty active and they're like, okay, I get it with this specific activity and it's really, really frustrating. And it's just a matter of retraining the muscle. It's like, okay, well, you were bearing down instead of drawing in, which we'll go over all of this at some point. And you get them drawing in more and they're not bearing down and they're not leaking. It's awesome to see that progress so quickly with these active patients too. Yeah. So I guess the purpose of this episode is to dive into why we want to know these intimate details and why it's not too much information, why we want to know those things about you and your history, And like any healthcare visit, what you end up sharing with us is completely up to you. And we really try to preface things and say, if you're comfortable sharing this, we would love to know, blah, blah, blah. But when, patients come in and they're saying, sorry, this is too much information, but I have pain with sex, we want to destigmatize that because that's something that we as pelvic floor therapists really want to know. We want to know about your sex life.
Yeah, exactly. Like I cannot think of one thing that's too much information. No. Anything you say, like, please do not hold it back because it can probably give me even more insight in what knowledge I can bestow upon you.
Not bestow.
Bestow. to help you.
So what are some examples of questions that you ask in your subjective assessments?
Okay, that's a good question. So what I tell people when they come in, I'm like, just letting you know, I am going to screen everything. So I'm going to ask you a lot of personal questions that you're probably not going to expect to be asked. So I always screen like urinary symptoms. So how often are you peeing every day? Are you peeing more than every 2 hours a day? Are you peeing less than every 2 hours? Are you only peeing once or twice a day? What does your urine stream look like? Do you ever have to push to pee? How much water do you drink? Let's bounce off of each other. So I ask urinary symptoms for sure. What do you ask?
Always urinary symptoms. And then the same with bowel. We're getting into bowel movements too. How often do you have a bowel movement? How often historically have you had bowel movements? So if someone's only voiding every other day, but that's what they've been doing their entire life, may not be abnormal. I always use that lovely Bristol stool chart of ours.
My poop chart. It's laminated, baby.
Show me what your poop looks like. I want to know what your poop looks
Everyone's reaction when I hand them that chart is the same thing. It's always like, oh my God. And I'm like, yeah, I know.
Yeah.
Give it to me. Let me know.
The bowel movements, we need to know about that. For sexual questions, just if there's pain with sex is where we start. How does sex feel?
When do you have pain?
When do you have pain?
Is
what
it
time?
Initial penetration? Is it deeper penetration? Is it the whole time? Does it get better? Do you have pain afterwards? How long is the pain? Does the pain last afterwards?
Can you reach climax? Do you
have you ever had an orgasm? Do you have pain with an orgasm?
Are your orgasms consistently the same strength? Have you found a reduction in pleasure? We want to know those things.
Not only will we screen like pelvic floor issues, but we'll screen like the musculoskeletal system as a whole too. So we'll ask about foot pain. I always say, like, do you have any other like relevant past medical history I should know about? Any musculoskeletal injuries? Any like knee pain, foot pain, hip pain, back pain, anything at all? Any abdominal surgeries? Tell me about any abdominal surgeries, please, because that is that's something that people are never aware. Like, yeah, I had like a gallbladder surgery or like my appendix removed. Like any abdominal surgery, I want to know about.
That tiny incision
can make a big old difference.
Big old difference. Yeah, and that's just scraping the surface. We inform our subjective assessments based on what feedback we're given at that time. If someone's coming in and their main issue is sex, we're going to dive even deeper into their sexual history. And we want to know, was there a time when it was different? What was going on at that time? We want to know all of those psychosocial factors. And we want to hear people's traumas if they're comfortable sharing them, because that can play a huge role in dysfunction around the hips and pelvis. We hold a lot of that tension in that area that we don't even realize.
100%. You know what? The biggest thing is like, I'll have someone coming in for like, let's say, for example, for pregnancy, and they'll be coming in without pain. They're just being like good little patients. And they're like, I heard about pelvic floor PT. I'm not having any symptoms, but I want to be prepared for delivery. And I'm like, okay, slay. Heck yeah. And then they're like, but I was filling out the intake form and yeah, I've been struggling with constipation for a very long time. It's like, okay, now let's dive into that. And then there's like another thing that we can just treat. And that's a big thing we want to touch on about our podcast. We want to answer your medical questions that you didn't even know you were supposed to ask, or like you didn't even know there were answers to.
Yeah, like if you hear us say something and you're like, what the heck? We can talk about like reduced pleasure with climax with a physical therapist, like ask us about that. We are more than happy to dive into those specifics.
Yeah. I would say my friend the other day, this is just a funny side note. My friend the other day was like, do you ever think about how you went to school for like 7 years and you just posted a video on the internet on how to poop? And I was like, yeah, and it's fucking cool.
It's so cool.
And everyone loves that. Everyone that comes up to me and is like, oh my God, I pooped today and it was a great poop. And I'm like, I love that you guys think about me when you poop.
I love that. That's so
People
good.
like send me pictures of their squatty potties and I'm like, this is so, I love this.
It is so funny.
Send us a picture of your feet on a squatty potty. That's what we want.
That's literally going to
Email
make our
hi
day.
at pelvic POV. We're just going to have so many like emails of just like squatty potty pics.
Yeah.
Just their feet though. You don't have to don't send anything else. Feet on squatty potty.
Oh my gosh. I also want to touch on, I know it feels like we're beating a dead horse, but when you see your healthcare provider, I just want to touch on how unfazed they are by this information that feels like it's way too much information. And as people who also go to healthcare providers, we know what that feels like. Like I've been at a physician's office and I'm like, I want to talk about this, but it feels like TMI. And I have to check myself. I'm like, what do I ask people every day that I want to know about? It's not TMI. I made a point to stop apologizing for not shaving my legs because as a PT, I'm like, the literal last thing that I noticed about you today was your leg hair. We still get people apologizing for this stuff all the time, saying it's TMI. And it's, I mean, coming to a specialty like ours, there is going to be some anxiety and stress associated with that because we do intimate exams and I know what it feels like to go to the gynecologist and can relate to that feeling very much.
If I don't shave to come to work, you don't have to shave to come to my work, okay?
Totally. And that's not to dismiss experiences where healthcare providers have not been receptive to all information, because we know that not everyone treats the same way and we can't standardize that, unfortunately, where everyone's going to be as open as we are. And I'm sure there's plenty of experiences where people have a provider that made them feel uncomfortable sharing something, and that's very real. And that's what we're here to do. We're trying to destigmatize medical care.
Yeah.
Right?
Yeah, you worded that really well.
Oh, thanks. It was like, wait, okay. Keep going. Still getting used to podcasting, guys.
There's no such thing. There's no such thing as TMI, okay? When I became a pelvic floor PT, I looked myself in the mirror and said, penis, penis, vagina, vagina, vulva, vulva. And now I'm 100%.
No, you did not.
You have to. You have to be comfortable. If your pelvic floor PT is not comfortable saying penis, penis, vagina, vagina, vulva, vulva.
So good.
Rectum. I don't know. You can't be uncomfortable saying that kind of stuff. We don't care. We care. We care. We're freaks for your pelvis. Okay, guys?
We're freaks for your pelvis, but we do not think it's too much information.
Yeah, disclaimer. We might say pelvic freaks sometimes, but it's because we're freaks for your pelvis.
We're not calling you freaks.
No, we're not calling you freaks. We're saying that we are all pelvic freaks.
But you might be, but like in a good way.
Yeah. Like Amanda says freak, and I like every time she says it, I giggle because I love it.
We're coming up with fan-based name ideas, and we like pelvic freaks. Like when you
because
want
we're manifesting, we're like, you guys are gonna love us. So like, what do we want to call you?
People are gonna like listening to us, so we need a fan-based name. Obviously,
Amanda's like, I want merch that says pelvic freak on it. And I said, I want merch that says, I'm a freak for your pelvis.
So pelvic freaks, let us know how you feel about it, please. If you're like, I don't like being called a freak, tell us, because I think we're desensitized to the word because we like it so much. So we want to hear from you.
We're just freaks about pelvic floor PT. Look at me.
Look at her.
Or listen to me.
Cool.
I feel like we're rambling now.
Yeah. Make sure to follow us on social media at Pelvic POV.
And follow our personal Instagrams at Hannah Meyer, Meyyerr.
And Amanda Neary, PT. N is in November.
N is in Nancy Drew, the sleuth detective. The sleuth detective is the same. Why am I saying the sleuth detective?
I don't know.
What is she? Like the master sleuth?
I don't even know.
Nancy Drew, the master sleuth.
Subscribe to our YouTube channel and our Spotify podcast and Apple podcast, however you listen to us. And make sure you stay tuned for our next episode where we dive into pelvic health even more.
All right.
All right. Bye, guys.
Bye, guys.